Sometimes patients ask me why I went into ophthalmology. And when I was in medical school, I realized that I didn't want to just treat conditions, I wanted to be able to cure them. And so I was interested in getting involved in surgery. And I was fortunate enough to get involved with some ophthalmology research and do an ophthalmology externship. And I realized that the elegance of ophthalmic surgery was something I wanted to get involved with, because not only can you cure people, but people were so appreciative, because sight is the most important one of our senses. Again, being in the right place at the right time in the early 1980s during my ophthalmology residency, I was interested, as I had been before, in doing research, and I heard about some exciting possibilities of a laser that was up in Columbia and had just begun with research. And so I was introduced to what was the person who took the first animal eye up to Yorktown in Westchester County in IBM, where they were thinking of ways to re-etch lasers or laser chips, and the excimer laser was one of the lasers they were experimenting upon. And this doctor put a cow's eye under this laser, and lo and behold, it made you believe in God, because he was able to reshape a cornea with perfect precision and without any burning, which almost all other lasers do. And so I was involved in writing the first paper in the world proving that the excimer laser works in refractive surgery. It was called excimer laser radial keratotomy. In radial keratotomy, which was the procedure with knives up until that point, was actually a very good procedure, and I did that really up through the very early 1990s, but it was very limited in what one could do, especially with large prescriptions or astigmatism. So my original research was at Columbia, and then I was recruited to go up to Boston to Harvard's Eye Hospital, Massachusetts Eye and Ear Infirmary, because I was one of the few people who had experience with the excimer laser, which is still the laser that's used to fix prescriptions for nearsightedness, farsightedness, and astigmatism. But then we had to wait for the FDA, and so my expertise also when I was in Boston was training to be a corneal microsurgeon. And so I did cornea transplants and reconstructions of the front part of the eye from trauma, in addition to cataracts and glaucoma surgeries and lasers. When the excimer laser was finally approved by the FDA around 94, 95, this is what I was always waiting to do. And so I transitioned my practice surgically to become what I always wanted to be, an exclusive laser vision correction specialist. And really from the mid to late 1990s, that has been the only type of surgery that I have been doing, and that I believe gives me an advantage because I super specialize in that. I do take care of patients for all their eye care needs as far as medical ophthalmology, but surgically I confine myself to laser vision correction. The two types of procedures are called PRK, and I was actually involved in writing the first paper in the world proving that PRK works in 1984. Actually, in 1986, it was published in the journal Ophthalmology and was called Large Area Excimer Laser Ablation. And from that, PRK evolved, and from that, LASIK evolved. And so today, I do about 50% LASIK surgeries and 50% PRK surgeries. Everything I always wanted to do when I started. Now it's about 30 years ago with the excimer laser.